So good day. In this topic, we will be tackling about the synthesizing bodies of evidence. But first, what is synthesizing bodies of evidence? So in synthesizing or synthesis, it basically means that we will combine a number of different pieces into a whole. So meaning to say, synthesis as a by definition, it's about concisely summarizing and linking different sources in order to review the literature of a topic, make recommendations out of it, and connect the field of practice to the research. And by this, synthesizing the research or synthesis is done wherein we usually go together with analysis because we want to break down a concept or idea into it, and it has important parts or points so that you can draw useful conclusions or make decisions about a topic or problem. And in addition to that, there are more reasons, or there are five more additional reasons for synthesizing the literature. So what are those? First is the developing research proposals that are required for academic degrees. Second is developing proposals required to apply for external research funding. The third is identifying research methods. Fourth is identifying experts in a given topic area. And lastly, identifying funding sources in a given area. So now that we have tackled about the reasons why we should synthesize the literature, there are three general approaches to as to how we can synthesize the research. And first is the narrative review. Second is the systemic reviews without meta-analysis. And lastly is the systemic reviews with meta-analysis. So let us tackle first each of them one by one. First is the narrative review. Narrative review is from the past. Okay, it's more focused on developing a conceptual understanding of the topic of interest. Thus, it is mainly characterized by their limitations because they rarely provide detailed methods about how the study was conducted. And despite that, there are still reasons why narrative reviews can still be utilized in the review of literature. So, take for example, the narrative review by Heath and colleagues. Their study is about the treadmill training with partial body weight support after stroke. So the narrative review basically provided a wide base of information about the particular therapy and providing thorough information. So with that, by providing a thorough information to the literature review, it could be one valid reason to conduct a narrative review for the synthesizing the literature. So the next way is the systemic reviews without meta-analysis. So as what we can see, the systemic reviews without meta-analysis are requiring documented search strategies and explicit inclusion and inclusion and exclusion criteria for studies that are used in the review. So we also have another example, a study by Bilney and colleagues where they conducted a systemic review of literature to determine the effectiveness of physical therapy, occupational therapy, and speech language therapy for people with Huntington's disease. So in the study or in their work, it exhibits the characteristics typical of a systemic review without meta-analysis. Um, Particularly, a research article format, a documented search strategy, explicit rules for including and excluding studies from the review, independent data extraction by two reviewers, formal ratings of study quality, and lastly, the results that are presented in tables that are summarized that will be important information for each study. So lastly is the systemic reviews with meta-analysis. In systemic reviews with meta-analysis, kaya they are differentiated from other reviews by their meta-analytic component. And the basic component or concept behind this is that the size of differences between treatment groups, or as what we know is the effect size, they are mathematically standardized so that it can be pulled across studies with different but conceptually related dependent variables. So those are the ways to synthesize the literature.
Preparing for a systematic review. Before a systematic review can be possibly done, there are 3 steps that our researchers need to complete. These are: first, determining the purpose of the review; second, identifying literature for potential inclusion in the review; and lastly, third, selecting studies for inclusion. In the first step, determining the purpose of the review, researchers have certain criteria in determining the purpose of the review. So this includes participant characteristics and diagnosis, intervention characteristics, and dependent variables of interest. So the specificity of the purpose statement should match the body of literature that is expected to be identified for the review. For example, the purpose statement for Bilney and colleagues' review of physical therapy effectiveness in Huntington's disease is relatively broad. So its purpose statement is to assist physiotherapists, occupational therapists, speech language pathologists, and rehabilitation physicians to effectively treat people with Huntington's disease by providing a review and critical evaluation of the evidence and physical therapy outcomes. In the second step, which is identifying the literature, so literature reviews are a set of insights from articles or journals that can be included in the research. So typically, this begins with a search of one or more electronic bibliographic databases. So since a systematic review needs to be thorough, clear, and reproducible, the researchers must carefully document the final search strategy used to identify articles for possible inclusion. So, and also an important note to take is that even though researchers uses multiple electronic bases, its history and procedure need not to be documented. However, once a set of search terms and limits, so such as the years included in the review, the language of articles is set, so the researchers should rerun the searches to obtain a definitive set of articles for possible inclusion in the review. In the last step, which is selecting studies for inclusion, so once a set of articles for possible inclusion in the review is identified, the researchers need to determine which articles are relevant to the questions at hand or to the topic. So, for example, the question is related to standard care plus CPM to standard care following TKA. So, for example, there are 100 articles that are related to the topic or to the title. So, these 100 articles are identified to be possible to be included in the review. The next step in selecting studies for inclusion is to review the article abstracts to ensure that each article is a report of original research, so that the participants have undergone TKA and that at least one of the comparisons in the article is between standard care plus CPM and standard care alone. So, for example, 25 articles are related to how, for example, how we do it articles, and then 16 will compare various CPM protocols to one another, and four will be full seats with participants who have undergone anterior cruciate ligament reconstruction. So it leads to only 55 articles for possible inclusion in the review. After reviewing the abstracts of the 55 remaining articles, so this might reduce the number of articles for possible inclusion to research. So once an article review confirms that an article meets the study criteria, so its reference list should be reviewed to identify other potential studies that possibly meet the inclusion criteria but were missed by the electronic searches. So some reviewers uses this strategy with hand searching of journals expected to be good sources of articles on the topic. So this is also with consultation with experts to determine whether they know of relevant studies, particularly unpublished studies that have been missed. So generally, the use of unpublished studies and sometimes the use of gray literature is discouraged in reviews because the studies are not accessible by traditional academic research or search processes or databases, so or have not been reviewed by the traditional peer process. So to further enhance the reproducibility of the systematic review, so there are two more reviewers should independently determine which of the 100 initial articles to eliminate from the review and independently determine whether to add any additional articles through citation, checking, or hand searching. So discrepancies in eliminated or added articles would be resolved by discussion among the reviewers or by consultation with another reviewer who serves as a referee. And lastly, since systematic reviews are always vulnerable to the criticisms that the search strategies were incomplete, that the authors selected the wrong set of studies from those identified, and that publication bias could have an impact on the review conclusions. So, to guard against these criticisms, authors should use comprehensive search strategies that extend beyond electronic bibliographic databases. Also, authors should also use more than one research to select studies. Also, should make their inclusions and exclusions criteria explicit, and should attempt to include information from relevant unpublished studies. So the issue with publication bias is the possibility that a higher proportion of studies favorable to the intervention being studied are published than are those unfavorable to the intervention. So either because journal editors prefer to publish positive results, or because authors more often submit positive results for publication. So at minimum, authors should address the possibility of publication bias in their narrative.
So next is synthesizing the literature. The next task is to undertake the intellectual task of identifying, organizing, and synthesizing the results across studies, initially examining the articles for methodological issues and then focusing on context issues. So there are 6 steps that can guide this process, which is first is to identify the important characteristics of individual studies. Second is determining the quality of the individual studies. Third is identifying important constructs across the studies. Fourth is making descriptive comparisons across studies. Fifth is pooling statistical information across studies if a meta-analysis is being done. And lastly, specifying problems in need of further study. Identifying important characteristics of individual studies. The first stage of a systematic review is typically to get to know each of the research included in the review. The primary author, the publication date, total number of participants, design elements, independent variables, dependent measures, and summary results are all retrieved as important characteristics of each study. Next, in determining the quality of the individual studies, many systematic reviews incorporate a formal quality assessment, which generally takes the form of a level of evidence approach if the research designs are diverse, or a score of method if the review is restricted to randomized controlled trials. Because the quality ratings are consistent and the item scores are similar, There's no need to give certain studies more or less weight depending on their methodological rigor. Even randomized controlled trials with excellent design ratings may have implementation faults that restrict their utility as a source of evidence. Narrative validity analysis, as discussed in Chapter 25, is also necessary to perform. Next is to identify important constructs across studies. The conceptions and variables that underlie the research rather than the individual studies become the emphasis of this part of the evaluation. So it becomes obvious, for example, that NIROM is a dependent variable in all of the studies in the review, while edema is only a dependent variable in 2 of them. Similarly, it is evident that there are more data to address a question regarding the impact of CPM at discharge than there are at 1 year post-operatively.
So in making the descriptive comparison across studies, so basically once each study has been examined independently, the reviewer compares results across the studies. So in our hypothetical review of CPM after TKA, we see that several investigators examine the impact of CPM on length of stay. So of the 4 authors who addressed this issue, 1 author found shorter lengths of stay with low dose of CPM added to the usual care, and the other 3 researchers found no differences in length of stay between those receiving usual cares or various types of CPM in addition to usual care. So having this identified a inconsistent finding, the task of the review author is to examine this conflicting evidence carefully to determine whether there are differences among the studies that might explain the contradictory results. So in this case, the only significant finding is in one of the older studies and the one with the weakest design. So the review conclusion would likely be there that there is no contemporary evidence that use of CPM or the continuous passive motion to reduce the length of stay after TKA. So similar comparisons across studies would be made for each of the factors of interest within the review. The full statistical data across study. So when there is enough studies with enough comparisons in common and with enough statistical detail, then statistical synthesis of studies can be accomplished through meta-analysis. So the meta-analysis has 2 important concepts, namely the use of confidence intervals for hypothesis testing and the pooling of effects across the studies. So a probability is determined in classic hypothesis testing, and a statistical conclusion is made when the generated p-value is compared to a specified alpha level. So a confidence interval is calculated for the difference of interest in hypothesis testing with confidence intervals, and a statistical conclusion is made by determining whether the confidence interval includes the value that corresponds to the null hypothesis. So the results of each studies are performed, or the results of each studies are transformed to confidence interval in a meta-analysis, allowing all the studies to be compared to a common indicator of no difference, even if the variables utilized in the individual research are not the same. So one of the major statistical concerns about meta-analysis revolves around the concepts of whether the different study results are homogeneous or heterogeneous. So homogeneity is desired and means that the results of each individual trial are mathematically compatible with the results of any of the others. So when the individual confidence intervals that are plotted on a forest plot overlap, then the trials are said to be homogeneous. So conversely, When some lines do not overlap with any other lines, the trials are said to be heterogeneous, and they are often thought to represent different clinical populations of interest. In specifying the problems that need further study, the results of systematic reviews with or without meta-analysis are generally considered for further studies because for some variables, the review may demonstrate consistent, rigorous results that can be considered definitive. So for other variables, the review may reveal inconsistencies in the literature that needs a further study and may identify gaps in the literature that require more study or may reveal a methodological limitation of the literature that needs to be rectified with more rigorous studies.
Reports of systematic reviews follow the format typical of a research article, with introduction, methods, results, and discussion sections. Reporting issues unique to systematic reviews are highlighted, including those specific to meta-analysis. In describing review methods, the method section of a systematic review needs to be explicit and reproducible. This means that it is important to provide detailed information on search strategies, on how studies were selected for inclusion, and on how data were extracted from the studies. Any systematic review needs to include a listing of studies that were included in the review. A typical systematic review tabulates basic information from each step of the synthesis. All these tabulated tables are examples of a systematic review, as what you can see in the PowerPoint. It is a results of meta-analysis that can be presented in tables, but they are often also presented in forest plots.